Okay, so you're gonna tell me that we're live or what? Okay. So looks like we're good to go. Okay. All right then. Hi everybody and happy Valentine's Day. How y'all doing? I'm doing okay. You know, hey, look at the flowers I got. So, let's talk. All right, so I have another question from another subscriber, and he asks, let me see. What do you think about medical device sales background? What would this be helpful or irrelevant? So I'm wondering if this well, let me clarify something. So he asked this on one of my videos that was about what I wish I knew before I started healthcare administration. Okay, so yeah, definitely. I think he's referring to, working it as a healthcare administrator or a healthcare manager, and if the medical sales device sales background is going to be helpful, right? Yeah, I think it's helpful at all, a lot helpful. So it's definitely possible for someone with this background to become a healthcare administrator or a manager, or, working on the business end of healthcare. You kind of already are in a way. I mean, I know you're on the sales end, but healthcare administration is super broad. So if you really want me to dig deeper in this, I would need to know a little bit more about what you're looking into. But I mean, just if we want to get into a list of things that of positions or manager level positions, administrator level positions that your experience would actually be perfect for, here's a couple. You could be a consultant. Okay, that's a good one. And it could be, in medical devices. It could be in, it's really almost anywhere. Medical equipment. You can work in, I think a lot that has to do with supplies and equipment and things like that, for sure, because you already understand, I'm sure, medical terms. You understand medical technology and devices and things that are actually needed for medical facilities to operate. So, and you also have the gift of, I'm sure, sales, because you've been working in sales, you have sales experience. That's actually that is tough, okay? Because a lot of people, that's actually a rare gift or a rare skill that you probably developed, I don't know. But that's something that it takes a lot out of someone to be able, especially in today's day and age, to be able to, connect with other people and get them to buy, especially with a stranger, and really be convincing and salesy. That's something that not everyone can do. And most people, especially today, are afraid of that. So if you have this sales background in medical devices, I think you're already ahead of the curve. Now, administration or business side wise, you can get into healthcare sales manager, medical device sales managing. You can really be a manager for anything having to do with that, just off the top of my head, of course. You can also get into healthcare business development. Okay, you can be a business development manager for a healthcare facility. You can get into, I think it would make sense to get into like operations management, but going Anything more than that, there are other areas, other fields that you would probably be really great at, but I think it would require some more education. So, what types of education would be required of you? Well, I think that you would probably be, having a medical device sales background. You should look into marketing and financial management, just a general hospital manager and administrator and whatnot. But usually to have that, you should get maybe an MBA or an MHA, or if you don't have your bachelor's already, you should go ahead and study healthcare administration, get a bachelor's in healthcare administration if possible. So you would need at least a bachelor's degree in hospital management, healthcare administration, healthcare management, something to do in the business end of healthcare, some sort of education. Okay, so you would need a degree somewhere in that area, right? You'll just have to do this, it's for your educational background. You'll have to add this into your education if you don't already have it. And, or it might also be fine for you to get a certification in healthcare administration as well. So depending on what you're actually interested in doing, what I would do is go look up those positions, maybe look up the ideas that I just gave you. Also, look up other ones because you do have really great experience. Look up stuff and then figure out what you're really interested in. Do you still want to do something in management or the business side of, medical devices and equipment and things like that? Is that something that you love? And you want to still continue working in that area, but you just want to be more of an administrator in that area. That is for sure possible, actually. You really would just need to maybe get a business degree, maybe get a certification, just do something for your education. But before you invest in your education, I would do a little bit of research. Okay, so and the best thing you can do is start looking up these specific positions that you are interested in. Find the people on LinkedIn who have those positions and start making connections and study their profiles, especially if there's someone who's active on LinkedIn, because that's a really good, because that they're constantly updating. They probably put a lot of their background and knowledge and what their educational background and their experience, they put it all out there so that everyone can see, probably because they want a job. But it's good for us who are exploring different work opportunities, because this way you can figure out what stepping stones those people took and what education they have in their background. Now, not everyone has the same education. It's not so clear cut. It's not like becoming a physician where it's like, you get your bachelor's degree in some sort of science-based major, and then you go to med school, and then you're a physician, and then you move forward from there. Many of these positions, especially in healthcare business and healthcare management and whatnot, it's not everyone that you work with is going to have the same degrees. There are multiple different things you can do, and not everyone's going to have the same experience, but there's probably going to be some similarities and also some things that you already have and things that you can easily do to get on those stepping stones and start working your way towards those towards that position that you really want. More than likely, you can get there in just a couple of years or even less, actually. I don't know what your educational background is, so that's why I just don't even know where to, where to steer you. But what I would do is honestly go look for the positions that you're interested in, and then just sort of reverse engineer them for you. And that should give you a really good idea about what you need to do. So if your question is just, do I have a future in healthcare administration? I would say yes, you do. Keep in mind, healthcare administration is super broad. So if you want something that is related to what you're already doing and where you're already knowledgeable, like in medical devices, there's plenty of space over there for you in the administrative level. Okay. You're already a valuable asset with and you're already, a valuable asset for a career in healthcare administration, because you already have knowledge of the healthcare industry. You already have probably developed relationships with healthcare providers and healthcare organizations, and you have a background in sales. Like I said, it's great. And having a background, more than likely, you probably have a good, you understand customer service, which is great, because some people do and some people don't. And some people who've never actually worked in customer service, when they do become healthcare providers, they're not that great. Okay, so they don't know really how to handle people. And I'm assuming you are really good at handling people. So anyway, you will need to develop knowledge of healthcare regulations, which you probably have a good understanding of, since you needed to know the equipment and the devices, right? But you'll need to know more finance and operations management, healthcare operations management, strategic planning, marketing, things like that. So that's something that getting a degree and just a generic healthcare administrator or manager degree would help you with. And then, but I think steering yourself in that direction would be amazing. You should probably get on LinkedIn and maybe message people who have these positions and just ask questions and things like that. Just be like, I'm looking for a career change and this is my background. What do you think? And just see what people say. Worst that can happen is they ignore you. But, I think you're in a good position. Don't know your education level, but I'm sure you're going to be fine. And yes, you have a future in healthcare administration, should you pursue it. So I hope that helps, and I'll see you later. I may go ahead and get out of this. Where in the world did it go? Here we go.